Audio, video, everything is okay? Just type in the chat box. Yeah. Just type in the chat box. Right. I'll start with my first question. Drug of choice for Enterococcus infective endocarditis, allergic to penicillin. Allergic to penicillin. Yes, infective endocarditis, usually treatment is you can give penicillin. But if the patient is allergic to penicillin, the best one you can go for vancomycin. That is the protocol given. How many of you made it right? Vancomycin. Piperacillin we are mainly using for Pseudomonas. Okay. So drug of choice for Enterococcus infective endocarditis, allergic to penicillin, you can go for vancomycin. Next one is, just a minute. Which one of the following shows drug resistance? So drug resistance commonly seen. Syphilis never exhibit any drug resistance. Chlamydia, the drug of choice is azithromycin and doxy. No drug resistance. Donovanosis, which is caused by Klebsiella granulomatis, which is drug of choice is doxycycline streptomycin. And drug resistance commonly seen in gonorrhea, because first we started with penicillin. After that, it developed into PPNG. Penicillin is producing Neisseria gonorrhoeae. It is 85% resistant to penicillin currently. %85% resistant to penicillin, PPNG. So currently the drug of choice for gonorrhea is not penicillin, it is ceftriaxone. It is ceftriaxone. Hope you all made right? Yes. Next is, which does not have polysaccharide capsule? If you see my notes, I used to say always polysaccharide capsule. Remember the mnemonic, or remember the what is called standard abbreviation, NHS organism. Neisseria meningitidis, Haemophilus, influenzae, Streptococcus pneumoniae. NHS organism. These are all classical example for capsulated pathogens, and we are having vaccine against them. So Haemophilus influenza type B, pneumococci, Neisseria meningitidis. These people are capsulated. Hepatitis B is not a bacteria, it is not having capsule. It may have envelope, that is different from capsule. Got it? No confusion. Next is, among the following, which need only female pathogen undergo self-fertilization. We call it as parthenogenesis. That is called parthenogenesis. Is a classical feature. It's a direct question. Parthenogenesis without male, self-fertilization of female, we can see in Strongyloides stercoralis. Strongyloides stercoralis. And we call it as ovoviviparous. It gave directly birth to, egg immediately become larva. We call it as this one. Okay. Among the following, we need only female pathogen and undergo self-fertilization is Strongyloides stercoralis. And which option is correct? After seeing the picture, what comes to your mind? It is India in the same picture I have shown in my notes. It's in my notes. If you see the workbook, you can see the same picture. Okay. This is called Cryptococcus neoformans. Once you identify this as Cryptococcus neoformans, okay, Cryptococcus neoformans, what is the right statement? Most commonly causes respiratory infection. Yes, it causes mode of transmission inhalation. It causes pneumonia, then disseminates. Broad budding cells with pseudohyphae. No. Pseudohyphae seen in Candida. Pseudohyphae seen in Candida. Human is the only reservoir. No. Pigeon. We get it from pigeon droppings. Flowering eucalyptus trees. Poultry. Prophylaxis given, CD4 count falls 900, not 900, it falls 200. Usually previously we give prophylaxis when it comes down less than 200. So among the choices, correct option is most commonly it causes respiratory infection. Most commonly it causes respiratory infection. Pseudohyphae we can see in Candida, not in Cryptococcus. It's India ink, negative stain, demonstration of capsule, Cryptococcus. Okay. Next is Streptococcus agalactiae causes. I already told you, see my notes. GBS. I used to say the same word. It is present in commensal in female genital tract. Any neonatal infection, neonatal meningitis, neonatal septicemia, neonatal arthritis, neonatal osteomyelitis, any neonatal infection. Any neonatal infection, you can think of Streptococcus agalactiae. What is the right question, Muhammad Taslim? So wrong asked. No, this is the thing I got it from my kids. In the group, you see the discussion is going there in the group, Micromagic group. Then the kids said, sir, Streptococcus agalactiae causes, these are all the choices. Infective endocarditis overall, Staph aureus. Staph aureus. Dental caries by Strep viridans. Strep viridans. And neonatal tonsillitis and pharyngitis. Group A beta hemolytic streptococcus. Group A beta hemolytic streptococcus. Got it? It's a direct question. Next is match the following. Always. These are all one-liners. Example for single stranded DNA, double stranded RNA, that you should know. Single stranded RNA, you're all aware of that. Yes, biofilm produced by Streptococcus, not agalactiae, Streptococcus viridans. Streptococcus viridans produces biofilm. Write the question full, Dr. Mehadharman. You write the full question, then I will take it. Okay. Even it won't produce biofilm. Even biofilm is there, it is not a correct answer. It produces neonatal sepsis. It produces neonatal sepsis. Biofilm producing organism, they may cause dental caries. Dental caries. Okay. Here, single stranded RNA, COVID-19, SARS-CoV-2. Double stranded RNA example is rotavirus, Reoviridae, and biofilm was there. Okay, I will write it. Option biofilm is there, I'll check. Next is, see carefully here. Single stranded DNA, one and only example, parvovirus. And double stranded DNA, you can go for human papillomavirus. All RNA viruses are single stranded except Rio, rotavirus. All DNA viruses are double stranded except parvovirus, which is single stranded. That's all. If you know this 2 point, you can answer beautifully. You can answer beautifully. Got it? Next is swollen Bartholin opening, vaginal discharge, clinical picture of pelvic inflammatory disease, gram-negative intracellular diplococci. It's a direct question. No need to think, no need to discuss. Gram-negative intracellular bacteria, kidney shape, which causes pelvic inflammatory disease, vaginal discharge, urethritis. You can go for the option is Neisseria gonorrhoeae. I can add biofilm option. Okay, I can add biofilm option. Good. Swollen Bartholin opening, vaginal pelvic inflammatory disease. Think of two people. Number one, chlamydia trachomatis. Number two, gonococci. Where there is gram-negative intracellular diplococci, there is no doubt 100% they are giving the diagnosis. They give laddu to you. You should give the laddu to your hand. You need to name it laddu like that. Neisseria gonorrhoeae. Yes, dysuria. That are the features of PID. Very good. I can add dysuria. Dysuria, vaginal discharge, even sometimes rash also they can give. Septic arthritis they can give. These are all the features. Good. Okay. Syphilis was option D. No problem. I can add syphilis. This for thank you, Dr. Preksha Singh. Syphilis I can add. But answer is Neisseria gonorrhoeae. Great. Thank you. Now I am getting complete question. Yes, Neil Patel, it is gonorrhea. Next is patient suffering from diarrhea. Stool microscopy shown in the image 15 to 20 micrometers. Oocyst, identify the structure. I don't know same picture or different picture, but oval. People said oval diarrhea 15 to 20 microns. My notes has 15 to 30 microns, 35 microns, same. In case of cyclospora, 8 to 10 microns, round. Cryptosporidium, 4 to 6 micrometer, round. Cystisospora, 30 micrometer, okay, 15 to 30 micrometer. Yes, you can go for cystisospora. 15 to 30 was there. Great. 15 to 30. I'll write it 30. Then the answer will be perfect. Cystisospora belli. It is isospora. Cystisospora belli or isospora belli. Both are correct. Okay. Yes, 30 micrometer. Good. That's all. Oval shape, one and only 30 micrometer. Watery diarrhea, especially HIV positives. You can think of one question always we have cryptosporidium, cyclospora or cystisospora belli. One question always there. Okay, right. Next is best diagnostic test for malaria speciation. Not malaria diagnosis, malaria speciation. Listen to me carefully. Speciation we can do with thin smear. Okay. Yes, Neha. Single oval structure picture. That's all. See here. It is cystisospora belli. Direct question. This time micro is very easy, very simple. People answered lot of questions. They're so happy. So with your notes, concise, crisp, small notes, we answered many questions. Okay, and that gives a lot of excitement to me. Best diagnostic test for malaria speciation is, listen to me, Giemsa stained thick smear for quantification. Giemsa stained thin smear speciation. Okay, acridine orange stained thin slide or QBC. Some people say QBC, quantitative Buffy coat analysis. You cannot speciate that much easily. You can quantitative Buffy coat analysis. And calcofluor, no calcofluor. Okay, acridine orange or QBC. I can write QBC. Is it okay? Is it okay? D was QBC, not calcofluor. Yes. No problem. I will write QBC. The best method, more than 100 years, speciation. is Giemsa stained thin smear. This is quantification. Same thing here, quantitative Buffy coat analysis. We can see the Buffy coat. We can identify, but very much you can speciate all the speciation. You can see the pigments, bands, everything. Okay, you can get the pigments, band, everything to see which species it is. You can go for Giemsa stained thin smear. Giemsa stained thin smear. Yes, I put QBC as separate option. Don't worry. Precision. The answer is Giemsa stained thin smear. Because my kids know the correct answer. They say, sir, answer Giemsa stained thin smear, sir. After that, they ask some other thing. They will tell the correct answer if you know. Wrong answers, they are difficult to remember. Okay, cool. Because of this session, I can make right questions. We'll modify it, don't worry. We'll modify as per your direct feedback. Okay, next is, yes, this is another question. This confusion is there. Extensive history of dengue, hemorrhagic fever, retroorbital pain, history of fever, and some people say rash also, and history of more than 5 days, because dengue hemorrhagic fever, already hemorrhagic fever is started. Okay, dengue fever, hemorrhagic fever, final stage is dengue shock syndrome. Dengue shock syndrome. Fever, hemorrhagic fever, dengue shock syndrome. Got it? So more than 5 days, best you can go for IgM capture ELISA. ELISA was there, yes. NS1 antigen, usually 1 to 3 days. Some books are mentioning 1 to 5 days. Because after 3 days, the antigen will be deteriorated. Sensitivity will be very less of NS1 antigen. Albopictus culture. Okay. Culture. D option. I put culture, viral culture. Viral culture. Not more than 5 days. That confusion is there. Don't worry. Even 5 days, best is IgM capture ELISA. IgM capture ELISA. On 5th day, capture ELISA is good. But NS1 antigen, the final limit will be 5th day. 3 days is best. You can take up to 5th day, but 5th day the sensitivity will be very low. I put one image in the group. You can see the image. You can understand better. It was given fever for 5 days. Yes, different people are giving different thing. Okay, people mentioned dengue hemorrhagic fever. I got the feedback. 2-3 kids are saying it is dengue hemorrhagic fever mentioned, sir. Dengue hemorrhagic fever. Okay, I don't worry. 5th day also you can go for IgM capture ELISA. 5 to 10 days, the best test is IgM capture ELISA. Okay. No, Dr. Devil, IgM, all other countries, that is a very important point you should learn here. All other diseases, IgM will appear after 1 week, 10 days later. In dengue, day 2 to day 3 onwards, IgM will be appear. Dengue is the one disease, day 2 to day 3 onwards, IgM will appear. Okay, so 5th day is IgM capture ELISA. You can go. And some sources are saying the NS1 antigen up to 5 days. It may be present up to 9 days, but that does not mean that 9th day it will be positive. We see when it is more sensitive, when it gives the sensitivity, positivity 80%, 85%, 90%, when you take that period. Got it? That is important. Thank you. Yes, sir. Mentioned, Muhammad Yusuf says dengue hemorrhagic fever mentioned. Yes, because I am taking material from 2 to 3 kids. After analyzing, I will make it. Okay, 2 to 3 kids, I am making it. Next is parvovirus B19 does not cause That means except question. It causes transient aplastic anemia, non-immune fetal hydrops. On 5th day, okay, I will correct, my dear, don't worry. I will write 5th day. Okay, is it okay? Vivek, Gajira? Okay, right. Parvovirus B19 does not cause. It causes fever with pethecal rash. Yes. The rash is called blueberry muffin rash. Okay. Slapped cheek rash. It causes rash. Non-immune fetal hydrops in fetus. And it causes aplastic crisis, pure red cell aplasia in sickle cell patients not immunocompromised. Not immunocompromised. It causes in sickle cell patients. Pure red cell aplasia. In immunodeficiency, it won't cause. That's called pure red cell aplasia in sickle cell patients, not immunocompromised. I will change the option. I will change. Both are same. Aplastic anemia or pure red cell aplasia. Both are having the same meaning. I will put the correct word. Pure red cell aplasia. I will put. Don't worry. Okay. Hydrops fetalis. Yes, it's there. Whether it is non-immune, immune, don't worry about the word here. Okay. I'll make it pure red cell aplasia in immunocompromised. That is the option I can change. I can change the option. Don't worry. Okay, this is not here, no problem. This is Ishan Goyal. Okay, right. Hydrops fetalis. Okay, it causes hydrops fetalis. It causes fever with pethecal rash. It causes transient aplastic anemia. The correct answer is pure red cell aplasia in immunocompromised individual. It won't cause. Next is, which organism transmitted through all blood components? You can think little bit, don't worry. Malaria present in RBCs. If you give other than RBC, malaria won't be transmitted. Filaria present in bloodstream. Okay, I got some points. Neha Jays, both wordings in option B. Pure red cell aplasia in immunocompromised. Rajamanikam Kalaivanan says pethecal, but many people says pethecal rash. You saying it's maculopapular rash. Just you can check. Okay, I'll put it bracket. I will check with other kids. Petechial rash also it causes. It associated with petechial rash, erythematous rash. Yes. Now I got Logan Mani says more than 5 days. There's a fight between some kids are saying 5th day, sir. Some kids are saying more than 5 days, sir. Okay, we need to balance. Don't worry. Yes, I will write the option here. I will check and I will modify. Don't worry. It causes hemolytic anemia. It causes hemolysis. Don't worry. Surely pethecal option is there. I'm sure, sir. See how within 2 minutes I'm getting different kind of things. I'm collecting the material from all the people based on that I'm presenting. Don't worry. I'm not the question maker. You people only enjoy the question you are field. Based on your experience, I'm writing. Hey, don't worry. Not immunocompromised. Another, this is from Dr. Vivek. Okay, right. Next is, come here. Filarian bloodstream. Toxoplasma infect all nucleated cells except RBC. It infect all the cells except RBC. So these three people not through all blood components, some blood components. Syphilis, syphilitic antigen present, it's antigen, syphilitic antigen present in all components of blood. You can go for syphilis. You can go for syphilis. I'm getting Mohammed Faizan. Pure red cell aplasia immunodeficiency. Yeah, that may be the correct answer. Aplastic crisis in hemolytic anemia. You can go for pure red cell aplasia and immunodeficiency. The right answer. Don't worry. What about other answers? Don't worry. I will make it. Mohammed Faizan confidently right. And Campylobacter says, yes sir, I remember slapped cheek petechial rash. Don't worry, we'll make it. Okay, right. Assertion reason, beautiful. Late trophozoite and scission not usually seen in falciparum. Yes, assertion is right. It's true. Late trophozoite and scission damages the capillary endothelium and sequestration. Because of the reason, we can't demonstrate late trophozoite and scission in peripheral smear of Plasmodium falciparum. So here assertion and reason are true, both are true, and it is a reason for the assertion. Okay. So assertion and reason are the true, both are correct and both are matching. Both are correct and both are matched with each other. That is the reason for the assertion. Both are correct statements. Both are correct statements, and that is the reason for assertion. Okay, right. Next is myocarditis, common known complication of facial diphtheria. True. Yes, cytoadherence with endothelium. Yes, my dear. This is called cytoadherence. You are right. Sharda Malik. Cytoadherence with endothelium. Both are correct statement. Your word is correct. I am expecting that is the correct thing they may give. This I will need to change because this is a correct terminology. Okay. Cytoadherence with endothelium sequestration is the correct wordings, scientific wordings. You are right. Sharda Malik, you are right. We need to change it. But both are correct. Both statements are individually correct. It is a reason for the assertion. That's all. Here, this is true statement. Myocarditis, common known complication of facial diphtheria, is a true statement. It is due to bacteremia by diphtheria. No, it is due to toxemia. So this is false. Assertion is true, reason is false, so it's not a match for it. Okay, assertion is true, but the reason is false. It is due to toxin mediated. It is exactly, I'm saying toxin mediated. 19 questions they asked from microbiology. But I didn't get none of the questions from immunology. Can anybody remember any questions from immunology? Nobody says one immunology question. I don't know whether they didn't ask or you people not remember. Just you can try now itself, no problem. Another 3-4 questions are there. Diphtheria causes bacteremia. Yes, no bacteremia. It is causes toxemia, not bacteremia. Great, Rocky Boy. Rocky Boy says all three are easy, sir. Good. Microbiology is easy this time. I am very excited of seeing the paper. Microbiology totally easy. Be happy. Okay, right. Next is processing sputum by adding N-acetylcysteine and NaOH for mycobacterial culture. True. This is called NALC NaOH method. What is the function of NALC? It is mucolytic. So liquefaction. NaOH kills other bacteria, not mycobacteria, kills other bacteria. Decontamination. Decontamination. About CD8 asked, I don't know what question it is. I'm happy to hear this, Neha JS. Okay. So N-acetylcysteine kills bacteria. NaOH liquefies sputum. Ulta. It is ulta, opposite. So reason is, assertion is true, reason is false. Reason is incorrect. Assertion is correct, reason is false. No matching. So as you said, all three assertion and reason are very easy, very easy, very easy, very easy. So NALC liquefaction, NaOH kills other bacteria, it kills contaminants. Okay, good. Just opposite. Next is, this is a question I didn't get, but some people said, I know the answer, sir, but I forgot the exact question and other options. Patient was injured with some rusted metal something. Mechanism of action of tetanus. They thought it is tetanus, and they give tetanus inhibit the release of GABA and glycine. It affects the SNAR protein. It inhibits the release of GABA and glycine in neuromuscular junction. Okay, Kaplan-Meier graph. Okay, right. It's pathology, allograft rejection. Rejection comes. Okay, right. Pathology question. Good. Spastic paralysis. Yes, Neha. I'll write spastic paralysis. Spastic paralysis. Okay. Question is on the way, my dear. Disposable pipette is aata hai, don't worry. Okay, GABA and glycine. Right. Lockjaw. Lockjaw, spastic paralysis, tetanus. Mechanism of action is this one. Okay, my dear. Okay, Avinash Mishra. Thank you. This is a pathology question. Don't worry. Okay, right. How to disinfect disposable mouthpiece of pipette? Multiple choices question. Okay. Pipettes. They didn't mention what material it is. Usually pipettes we are using glass pipettes. Okay. And we can use it either by autoclave or hotter oven. History of trauma, what is mechanism of associated toxin? Yes, okay, Dr. Shreyas N. Same thing. Good. Okay. So pipettes, you can go for not microwave ethanol we are not using. We can use autoclave or hotter oven. I don't know what kind of pipette they use. They have different types of pipettes are there. Automated pipettes are there. Manual pipettes are there. Glass pipettes are there. Even plastic pipettes are there. They didn't mention anything. Okay. Multiple choice. I can go for autoclave and hotter oven. I thought they maybe give glass pipette. Okay. Autoclave and hotter oven. Ethanol we are not using for any pipette cleaning, and microwave also we are not using. Mainly autoclave and hotter oven. Okay, we can use, because the question is not much clear, I assume. And mother with history of painful genital lesions 1 year before, 18 days old child has CNS symptoms and multinucleated giant cell seen. Wherever you can see multinucleated giant cell, painful genital lesions, that is important. Varicella zoster, it won't cause genital lesions. It causes lesions in the trunk, body, many places. Genital lesions, and it is passed through the children, is herpes virus simplex virus 2. Herpes simplex virus 2. Herpes simplex virus 2. And I am getting the question answer from Dr. Bandana Panda, plastic pipette was there. No, this is not a disinfectant agent. See, ethanol, and some people say ethanol 90%. It is 70% or 90%. Ethanol we are using mainly for hand sanitizer, cleaning of stethoscope, those kind of things. It is intermediate level disinfectant. Pipettes and all we need to use high level disinfectant, sterilization or high level disinfectants. That's the reason. So no option with both autoclave and hot air oven. Plastic not mentioned, Lively says. Some people say plastic mentioned, some people say plastic not mentioned. I am not aware of that. Okay. Microwave we are not using. Routine sterilization procedure we are not using microwave. We are using hot air oven, autoclave, those kind of things. We are not using microwave routinely. Multiple options, no. Multiple options. Where Coxsackie? Here we can see Coxsackie. Coxsackie A causes herpangina. Hand, foot, mouth disease. Hand, foot, mouth disease. Okay, Naga JS specifically mentioned tip of pipette. Tip of pipette. Okay, now I need to change. If we go to the tip of pipette, we can clean with ethanol. Tip of pipette means I need to change with ethanol. If the question is tip of pipette, okay, I can go for ethanol 70%. Ethanol 70%. Okay, here one more is Haemophilus ducreyi. Haemophilus ducreyi, painful genital lesion, but it won't cause CNS symptoms and multinucleated giant cells. This is important. Multinucleated giant cells, diagnostic of herpes simplex virus 2. Okay. Okay, tip means I can go for ethanol 70%. Tip of the pipette we need to clean with 70% ethanol. Okay, as automated pipette. In the tip we are changing the mouth, the pieces actually, disposable pieces that time. But the word disposable should not come. So the question will be how to disinfect tip of pipette. If it comes, I can go for ethanol. Nothing wrong in it. Yes, one question, Dr. Machra Rama. Sir, question, Kernicks and positive occult rigidity is meningitis. It is meningitis. Yes. Microwave tip cleaning we can use for microwave. Not, you're right. Ethanol is disinfection. Okay, disinfection is ethanol. You can go for it. Okay. So if question is not very clear, my dears, that is important. If question is clear, answer should be very clear. Just now I got the information, tip of pipette. Tip of pipette. You can go for ethanol. I don't know what else they mentioned. Sometimes they may mention something which is favorable to microwave also. Okay. Ethanol as answer. Okay, leave it. Don't worry. Okay, right. Again, I'm getting information from the people. We'll modify. Don't worry. Next is mother with painful genital lesions. It's herpes simplex virus 2. That's all. Okay. Tip of disposable pipette. Okay. How they sterilize. Right. like that question was framed, but I will check it because without a complete idea I cannot say. Logan Money, my thinking also correct actually. I mean my thinking also the same way. Hey, don't worry. It's multiple correct answers. So maybe the design for ethanol and microwave may be correct, but I will check before that. I will frame the question according to that. Don't worry. This is the first hand information. Just a few hours before the exam over, whatever you people remember, aram se you can sit, think, whatever modification you put it in the group or you can mail me, message me. We'll modify. We'll make a perfect set of PYQ for your juniors. That's all. You are not going to use it. Be confident. I will not use it again. I will get the seat. It's only for my juniors. I will use it. Okay. So just you can modify the question, frame the correct words. You please put. I will modify because many people say plastic is there. Many people say no plastic is there. Pipette. Okay. So many people say rash is there. Rash is not there. So confusions are there. Just I am getting the information from you and I am reproducing. That's all. That's all. So 19 questions we have discussed till now. No, Kernickson positive also not this one. Painful vesicle, you can go for herpes simplex virus 2. Okay, it also causes aseptic meningitis. Chaitanya says. Okay. Wrong cytopathic effect. I didn't came across the question, Rocky boy. You just post the full question. I will add. Okay. It was written disposable pipette. See within 5 minutes how much amount of controversies we are getting from my kids. Okay. Hey, don't worry. I will add it. Okay. We'll make it. Yeah. Perfect. 19 questions are there till now. Good. It's almost 10% of your total population of questions microbiology. So if microbiology questions are maximum questions are right, it may be a game changer for you. So wrong cytopathic effect. You just post the question, I will add, my dear. You just post the question, I will add. Okay. So with this, I will complete the session. Thank you very much. God bless you and hope see you as a PG soon. Waiting for results. Don't be panic. Don't worry about the questions, other thing and all. Okay. Just recollect. Put your 100% effort. Sleep well, my dears. Okay.